Good afternoon, everybody. I want to thank Daniel for the invitation to come, as well as for that generous introduction. It sounded like I was running basically everything in DC, which is a little bit of an overstatement, but I do appreciate the introduction. Thank you very much, Daniel. So, once again, I come from the HHS Idea Lab. This is Washington, D.C.'s Department of Health and Human Services, and this is our innovation office where we are focused on innovation, design, entrepreneurship, and action. And I'm going to tell you two things that I'd love for you to walk away with today. One of which is a little bit about our open data agenda, the strategy, and how it is that we have formulated the current environment for open data at the department and what that looks like going forward. And then I'm going to tell you a little bit more about what the Idea Lab is trying to accomplish in terms of changing the way that government does the business of government, more modern and more effective. So I think we all know this one. Healthcare is a massive part of our gross domestic product here in the United States, and that is a growing number, and fortunately the utilization of data and resources are going to help us to drive changes that are going to drive these numbers down, because we are now living in a healthcare system where data is in fact driving change, and you can think about that from a couple of different perspectives. Data is changing payment reform, as many of you have seen through activities at Centers for Medicare and Medicaid Services. Data is changing the individual's interaction with the healthcare system. Many of you know this by virtue of your own devices that you've got on your wrist, in your pocket, or what have you. And that's providing you information that you've never even had before, as well as data is impacting and affecting treatment at the point of clinical care. And so what we're trying to do at the department, and it is in fact a very much ongoing process, is change the default setting for data from closed to open. And when I talk about the department, I mean it is a massive agency, so you can imagine what an undertaking that is, but you can understand that that's incredibly important for delivery system reform. Better care, smarter spending, and healthier people are all going to be data-driven activities in every corner of the country, from the capital to large states like California, and every little state and city across the nation. So, pardon me. One of the things that we are trying to do is, for example, target a percentage of Medicare fee-for-service payments linked to the quality and alternative payment models in 2016. You probably saw this as a recent announcement out of the department. And the first thing that I saw when I saw these slides and I saw this announcement was how important data and information and interoperability of our systems and connectivity across domains is going to be so important in order to get to anything that's going to be impactful for the change in how it is that we are paying for our care, let alone the responsibility that the individual has in participating in their own care. So when we talk about Department of Health and Human Services, you all may know this, but for some of you who don't really realize the depth and breadth of the agency, there are some major names in that agency that have their own brands and identities that don't often necessarily get associated with HHS. Food and Drug Administration, the Centers for Disease Control and Prevention are massive entities, National Institutes for Health. And when you look at them, you start to realize that they too are massive agencies unto themselves, and it keeps growing and growing as you delve deeper and deeper into HHS. So the challenge then becomes, when you're trying to change this default setting from closed to open, how is it that you can get down to the most granular level of where the programmatic, the project, the research data live in order to get that data to be openly available for all kinds of innovative uses? And there's some innovative uses in here that are truly inspiring to us as stories about why it is that we should in fact continue to try to fund and encourage these activities in open data. And so I'll just point out to you, many of you may already know this, but healthdata.gov is the Department of Health and Human Services portal for finding and discovering any of the data resources across all of those agencies you saw in the circle. And we're actually in the process right now of changing healthdata.gov to be a newer version. Healthdata.gov was launched 5 years ago for the specific purpose of getting a small handful of data sets out. There are now 1,000 data sets across the Department of Health and Human Services. There are data sets that are federated in from state catalogs like that of California. And there are all kinds of data resources and tools in there. And 5 years ago in web development time is a very long time. So we've reached the point where we need to modernize healthdata.gov in order to increase the value that comes from the data and build on the user experience that many of you actually hit on today. I was listening as the comments came back from the exercise that you did this morning, which, by the way, was very cool. Shout out to Shell for thinking that up, because that was awesome. The fact is, you all had an experience that was very valuable that's going to drive knowledge back to the California Department of Health and Human Services that says, here are some of the challenges and problems that are occurring when people try to access the data. How is it that our employees can actually use the data? Versus, how is it that the innovators can reduce their time spent on the site in order to directly get to the data? So we are also thinking through how it is we can make our platform stronger in order to increase the value of what it is that people can get from our data sets. So I'll tell you a couple of things real quick about our strategy, because I think that can be important in terms of thinking through how it is that other states and local entities can embark on their own data journeys. And here are some of the items that we've been thinking through. You may have seen a release of our open data strategy some time ago on the blog on healthdata.gov, and it goes into approximately 5 different things. Advancing the healthdata.gov site, which I've already talked about. Highlighting the departmental assets that support achieving HHS's strategic initiatives. So we've got our own strategic plan, as many of you do, but one of the things that we've tried to realize is if we're not releasing data that are actually directly relevant to the strategic goals of the department, we're probably missing the mark in some way. If we've openly stated that that is our strategic goal and we need you to help us to reach that goal, then we also need to release the data that are going to be supportive of those strategic goals. We want to educate new and existing and internal and external participants, and there's a lot there. There are plenty of people who have already been using plenty of data from HHS. There are always new people who are inspired in some form or fashion to come to HHS and find data resources. And so we want to educate both parties on how the data has evolved for the existing customers and how the data is useful for the new customers. But again, we want to also hit those who are our colleagues across the department, as well as those who are outside of the department that are doing interesting, cool, and creative things. Excuse me. We want to enable and incentivize the utilization of our data. You can put the data out there, and you can not actually say anything about it. But if you've not tweeted that the data's out there, if you've not blogged that the data's out there, if you've not gotten the person from behind their desk who is the expert in that program that produced that data set to step forward and say something in an open communication that can be valuable for other people to understand how the data was collected and curated, you're probably missing an opportunity. So we want to enable people to use the data by communicating about it, by incentivizing them through prizes and challenges, competitions, and things like what you did here, even the data hunt. Another thing that we want to do is make sure that we're implementing the administration's policies on open data, and that comes from 2 forms. There's the department's own set of policies that we've been very focused on, and there's also sort of the White House Office of Science and Technology Policy, OMB, range of cross-departmental open data initiatives that they are focused on, and we want to make sure that we're in alignment with both of those things, which I'm happy to say we very much are. In terms of some more specific things that have been happening, I'll shine an example on a recent policy that came out. Well, actually, the policy itself came out a year ago, and the department recently released its own strategy in the availability of public access to research data. So for the researchers in the room, you've probably recognized the extensive challenge that exists in the research enterprise in trying to collect and curate data, pay for that data, and once you've obtained it, actually going through and sifting through all of the voluminous data that you've now received. What we realized is, at the federal level, we have research agencies that are very large, and they've got humongous budgets. And the opportunity to actually release that data for some level of alternative use creates a whole new set of value across the ecosystem. So any federal agency that has a research budget of $100 million or more has been required to participate in this public access to research data. So I'm pleased to say that my colleague Elizabeth Kitchery has been instrumental in corralling all of our research agencies into getting to a place where they could reach a point of releasing their own research policy agenda. So that's up on the healthdata.gov site right now. Just to show you who those agencies are that are impacted by that: CDC, FDA, Administration for Health Research and Quality, the National Institutes of Health, and another agency has volunteered to participate in the public access memo, and that is our Assistant Secretary for Preparedness and Response, whom we refer to as ASPR, because in DC we like to pronounce our acronyms. So I'll give you a couple of examples of how it is that the data are being liberated and what are being used, just so that you can get a feel for the things that are happening in DC. So CMS is using data to spur health transformation. They have a data navigator, which is very similar to healthdata.gov, but the data navigator, along with other data portals across the department, federate up to healthdata.gov. So you can find data from across the department either by direct access or through healthdata.gov. They've been releasing all kinds of information on quality indicators across the board. And one thing that I think has been really interesting and valuable is their recent release of their virtual research data center, which basically says we recognize the expense and the time it takes for us to package up and release your data to you, and by the time we get it to you, now it's out of date. And so what they've decided is they're going to put up a virtual resource center that would allow people to basically buy a seat at the table, log in, gain access to more real-time data. It's not real-time, but closer to real-time in order to do your research activities. And so a company that you may have heard of before, Aiden, has been capitalizing on CMS data for quite a while. They are actually changing the post-acute care experience, where normally when you are in a care setting and they would like for you to follow up with a specialist afterwards, you would receive a sheet of paper. And on that paper is a whole list of folks whom you have no idea who they are, let alone what kind of quality of care they are providing. Aiden has taken quality of care data from CMS, matched it geographically with your own location, so that you now can start to figure out who in my location is delivering quality care, so that as we get to that CMS alternative payment reform system stuff, you now are participatory in the process of selecting quality care, and you are now part of that ecosystem in a more knowledgeable fashion in terms of following up in a specialty setting with someone who's providing high quality care. Open FDA, many of you may have seen this also. This has been a very successful initiative where the Food and Drug Administration have released several data sets that were that public never had access to before. Medical device and adverse events, recall reports, and the prescription drug and over-the-counter drug databases. As part of a regulatory entity, that's a huge leap forward. They were constantly in the process of holding data back. To have an open portal that is now releasing data with APIs is extremely valuable. And the example I'll give you here is an organization called Pillbox. And I love this example for two reasons. One, because they are using the Open FDA API, but two, because they are part of the Department of Health and Human Services. Pillbox is out of the National Institutes of Health, National Library of Medicine, NLM. And Pillbox has been embarking on a voyage to try to capture images from pills from all across the healthcare system. They've got thousands and thousands and thousands of images of pills. Because every single one of us has opened a drawer in your bathroom one day and you pick up a random pill and you go, oh boy, I have no idea what this is, right? But the opportunity is way bigger than just you and me as lay users. The opportunity expands to the Department of Veterans Affairs, who has millions and millions of people who are constantly in and out of the healthcare system and identifying pills in some level for healthcare providers, etc. So Pillbox, my example here, is both an internal utilizer of HHS data as well as someone who provides that data out for others to utilize. Pillbox is something that you can gain access to in terms of its image resource library for any of your innovations. So that's why they get 2 arrows. I'll tell you quickly about big data to knowledge at the National Institutes of Health. Basically, they are trying to figure out where are the places their data resides. How is it that that data can be made available to alternative users? But how can we actually really start to get to a place of provenance of research data? How can we actually get to a place of training the research enterprise, all of the people involved to accept that their data is valuable for an alternative purpose than what it was originally collected and curated for. Because I'm not a researcher, but it is my understanding that researchers are very, very protective of their data because of how much time it takes to actually collect it and curate it. And so Clinicast has been using National Institutes of Health data for quite a while, where they are using cancer registry data in order to create better cohorts of information for oncological studies. So Clinicast is really sort of changing the game in how it is that NIH puts out data, as well as how they can alternatively utilize that data. I want to mention one last agency here because I really like to bring the social services and human aspects of the data out for everybody. We frequently focus on the clinical setting in terms of how data is utilized. And we frequently focus on how it is that medicine itself is, in fact, using data and electronic health records and things along those lines. But one of the things that we don't really underscore is the fact that when a person leaves the clinical visit and they're out in their community, they've now left that 15-minute window and they're living the rest of their life where they're making decisions about how to keep the lights on and other things. How do I get gas in the car? Things like that. And if they are not able to gain access to social services resources out in their own community, you've lost them in terms of the clinical interaction that you have. So if we can connect people with better social services data and resources, we're going to offer a significant opportunity to improve the entirety of the healthcare ecosystem, inclusive of social services. So I just want to point out quickly Purple Binder, whom you may have heard about. Purple Binder is an organization that basically has traversed Chicago in trying to find social services information, and what they realized is that their social services providers are actually collecting large quantities of paper in big, huge binders and are unable to actually efficiently and effectively find the services that you might need in order to be a healthier individual. So Purple Binder is using all kinds of location-based data in terms of social services and things along those lines to ingest them into their system and provide social services workers with the ability to tell folks where it is that they can get some of these alternative services that are then going to reduce the burden of what these folks have to think about in terms of their own care. Now I want to pivot a little bit off of the data piece and over to the HHS Idea Lab piece, because I think that the Idea Lab is an inspiring way to see how it is that government is really changing how it is that we do the business of government. We're trying to cultivate innovation for a more effective government. And that sounds really cool in like a corporate setting, but it's probably hard to imagine in the government space, right? You can't imagine necessarily walking through the halls of California Department of Health and Human Services and thinking that folks are embracing this particular idea, but what I would like you to, and here I'll tell you a couple of things about it quickly. So the Idea Lab is basically, again, innovation, design, entrepreneurship, and action, and trying to cultivate those things across the department. I put this in here because in the State of the Union, after the State of the Union this year, the President actually mentioned the idea that the Idea Lab is something that he wants to see be promulgated across other departments in government. And so I want to encourage you to think about how it is that you can take Idea Lab concepts, which we welcome, and use them at your own localized level. So what he said was, in the President's budget, we'll also support the ability of several federal agencies to create their own versions of the HHS Idea Lab. I basically said that already. But I think that that's critical because it shows how it is that we are trying to embrace innovation and spread it across the federal agencies. So I'll tell you for a couple of minutes about some of our programs, just so you get a feel for what it is that I'm even talking about. The HHS Ignite Accelerator is basically a seed fund for the small ideas that you might have. You've been sitting at your desk for years and years and years, executing on your job, and you know there's a way to do it better, but you got no way to experiment on it. You got no resources. You don't know who to turn to say, I have an idea, how do I figure this out? So the accelerator sounds a little bit like it's all about money, but in fact it's about resources too. How do you think about things like lean, agile, and other kinds of outside of the box, not necessarily governmental approaches to doing things, so that you can have the resources in your toolbox to change your mindset, as well as a little bit of money that may be necessary in order to fund whatever it is that your project might request. The Ventures Fund is a slightly larger pot of money and resources that has a higher level of interest. So the Assistant Secretary for you name the operating division has bought into the Ventures Fund and said, this is a priority for me, and I would like for us to have a Ventures Fund associated with this. The HHS Innovators Award is one of our oldest pathways for recognizing innovation, in that we've basically decided that we need to celebrate the innovative activities that are happening across the department. Come, tell us what it is that you've done differently. You may not have had money and resources to do something. How is it that you surmounted that problem and actually still got the job done? And the HHS Innovates Awards is really interesting because the secretary actually reads all of the award submissions and makes the selections for who it is that he or she is going to actually choose. So it really truly has top-level buy-in. I'm going to tell you quickly about a couple of other things. The HHS Buyers Club is one of our newest and actually somewhat high-profile things right now, because the Buyers Club is trying to change the processes that we utilize for IT acquisitions. Government is notoriously bad at buying computer services. Many of them fail. Many of them are over budget. Many of them are, you name the negative thing that you could think of. And so if we can change the processes for which we are acquiring IT services in order to consolidate some of the demand, in order to create less waterfall development projects and more agile development projects, we're going to reduce costs, reduce time to delivery, and be more efficient with our IT projects. And this is actually something that the president has embraced as well. And by that, I mean literally the guy who came up with the Buyers Club went and sat with the president and told him what he was doing. I thought that was really cool. HHS Competes is basically our internal sort of prizes and challenges. How can we inspire more folks to innovate? And the Health Data Initiative is what I've already talked about. I want to make sure to skip ahead because I want to tell you about the HHS Entrepreneur in Residence that we currently have working for us. Entrepreneurs in Residence is a program where we invite expertise from outside of the department to come into the department and help us to try to solve a problem that we've identified that they agree is something that they're interested in. And the example that I'll show you here, just to bring it on home, is one of our prior entrepreneurs in residence was focused on the organ donation and transplantation system across America. And some of you may have heard this story, but I like to bring it home because it brings a real human element to what it is that we have the potential to impact. And so organ donation and transplantation is something that may not necessarily always have the most efficient processes. And that's probably a scary thought to think of when you recognize what it is that is the cargo in this system. And so the Entrepreneur in Residence program put out a request to have folks submit to be part of the program, and lo and behold, someone from the United Parcel Service came and became the Entrepreneur in Residence. And what he did was he basically went out on walkabout and he tried to figure out all of the different processes across the organ donation and transplantation system. And what he realized is there was no real good and solid identification process at the very beginning when the organ is actually identified and begins its process for transplantation. So you can see how inviting external expertise is really changing the game and how it is that we can make serious and real impacts in some very neat and cool ways. So I want to hit you with one more thing here, which is our demand-driven open data project. We have an entrepreneur in residence right now. The guy's name's David Portnoy. He's a serial entrepreneur, and he has been a very prolific user of our data. You can see his email address down there. He's been a prolific user of HHS data for a very long time, and we invited him in to participate in our HHS Creative Database Linkages project. And what we were thinking starting off this project, and this is indicative of how we like to be able to change and be nimble and how it is that we're perceiving our own activities so that we can change the foci of those activities. David came in and we thought he was going to literally be a person who would go to one agency and then another agency and connect and link those data sets. But what he realized as he started to talk through a bunch of the different activities that were already happening across the department is he's not actually the one that needs to do it. You guys are. And so what he's decided is that he's going to create a platform that's going to allow for what we're calling demand-driven open data. The department does not have endless resources to make all data sets available all the time in all of the highest levels of liquidity. So we have to figure out how to get demand and signal from the noise in order to understand where we should prioritize. So David has been embarking on a voyage to sort of discover what the use cases are for some of our data sets, populate them into a platform that he's now building out, and he's only just begun to roll out demand-driven open data. So you guys are some of the first to hear about it right now. And I'm excited to see what's going to happen for him over the next year as he builds out the platform and the use cases, and he hears from all of you as to what kind of data you would be interested in at the federal level. But I'd also be interested in having you all contact David and go to GitHub and learn more about demand-driven open data and see if it's something that you can adapt to your own utilization as it unfolds. So I'll skip the slide about the process because I think I drove it home. I want to also encourage you guys to think about the Health Data Palooza. For those of you who are not familiar, this has been a conference that has evolved over the last 5 years. And it has arisen out of the open data efforts at the Department of Health and Human Services. And so the Health Data Consortium, Chris Boone in the middle of the room trying to hide in plain sight, has basically been leading up the Health Data Consortium's efforts to try to bring the conversation about open data, about all kinds of activities in data interoperability and connectivity, some of the connections between clinical and social services, and all of those interesting conversations about how we can utilize data to improve the healthcare ecosystem. The Health Data Consortium has been central to that conversation, and they are the owners of the Health Data Palooza, which is coming up in the beginning of June 2015 in Washington, D.C. And so the great thing about it is you get the opportunity to meet a whole bunch of feds who can tell you about the data that we have. But you also get to meet a whole bunch of people who are not from California and learn about what they're doing. So in closing, I would love to just invite you all to help tell the data story. We put our data out, and the challenge then, I think, is offering back what the value of that output has been. I would argue that telling the data stories is incredibly valuable. It's free, and in fact, you can turn to your colleagues and say, I took your data, I gave it to her, and she did something awesome with it. And that then is a use case that you could turn to someone else and say, let me tell you about the thing we just did over here, and you start to really get a lot of fodder for additional open data activities. And then I would just encourage the California government to think about what it might mean to have an idea lab in the state. You know, we've got all kinds of entrenched ideas that we need to break up, and I think that idea labs popping up, not just at the federal level, but at the localized level, are going to be incredibly valuable. So I thank you all very much for your time, and I appreciate your invitation to come and speak with you this afternoon. Thank you very much. I may have gone long. Do we have time for a question or two? Probably need to keep on. One question. Who's got it? Put your hand up, quick.
What else, besides you set apart strategies, in regards to strategies, how can we use these strategies to influence open data here in the state of California?
Say more about what you're trying to influence.
Influence. We have barriers here. Let's admit, we'll always have barriers, but how can we go around those barriers? How can we sell this?
I think the selling comes, as I said at the end, in the storytelling. A lot of times you have to ask forgiveness, put something out there and encourage someone to use it, and then show how it was used for something good. And I had a conversation earlier with a gentleman, and we were talking about how a lot of times our colleagues across the government will think about the most negative possible thing that could happen with the release of the data. And judging by the nods in the room, I think we all agree that that's not necessarily the mindset we want to have. And so actually putting the data out to a trusted source sometimes. There have been instances where some of our organizations have reached out to a specific entity and said, we're about to release this data. I want to give it to you so that you can prove the utilization, the use cases that will create additional value from this data. And then we now have both the data openly available and the story of how it was used in your specific use case. And that can be incredible for all kinds of internal, see, I told you this was a good idea, and hey, innovation community, look what these guys did with the data we just put out. So I think that there needs to be a little bit of give in terms of let's test the waters a little bit, let's get some data out there, see what somebody can do with it, and then we'll open the floodgates, right? So, all right, you guys, thank you so much.